Welcome everyone to the second Nightingale Challenge webinar organized by Early Career Nurses Working Group. I'm Francesca, I'm a member of this group as well as a co-chair of today's session. Today we will focus on scientific writing and dissemination of results specific to cancer nurses. Our goal is to empower nurses with essential skills in scientific writing, enable them to make excellent contribution to the field of cancer nursing throughout journal publication and conference presentation. During this session, participants will learn the fundamental of scientific writing, will master the art of abstract development, explore strategies for effectively communicating results. The webinar is divided into parts, and there is also a Q&A chat where you can write questions. The first part will be presented by Dr. Garcia Vivar. She will guide us from idea to ink, crafting scientific paper. She's a professor in nursing at the Department of Health Sciences of Public Health, University of Navarra in Spain, and a fellow of UDOM of the Faculty of Nursing and Midwifery of the Royal College of Surgeons in Ireland, Dublin. She's an experienced researcher in cancer survivorship, family nursing, chronic illness, and quality research, and holding several leadership and management positions in European and international organizations. I would like to thank her in advance, and I hand over the floor to her. Thank you, Christina, for your presentation.
Thank you, Francesca, for your presentation. I will share my screen, hoping that everybody can see the screen. Is it okay?
Yes, we can see that.
Okay. Well, first of all, thank you very much for inviting me, early career nurses from the European Nursing Society. You are the new generation of nurses, so it's an honor to be here and to share with you my experience in writing, in researching. I also anticipate that there are different experiences within the participants who are, watching or sharing with us today's webinar. I'm sure there are participants who have never published, others who have some experience, and others, are part of a research project. So I hope you will help me with this presentation. So let's go and let's start my presentation, which is from idea to ink. So how to start a scientific paper and why to write a research or review paper. Well, I have nothing to declare, no conflict to declare. So what to publish? There are many reasons. The most important reason is to, of course, to contribute to our practices and to have an excellent nursing-based interventions through evidence-based practices. So that's why it is important to publish the most recent results to improve our practice, but also to share innovative ideas and improve patient outcomes. It's relevant for us as oncology nurses all over Europe and all over the world, of course. And the third point is for professional growth and career advancement. In your case, that you are early career, I think it's really important to combine both practice and research and writing and sharing with others what you have conducted or what you are doing in your daily basis. Others have also write about how to publish and if it is worth writing a research paper in 2024. This is an editorial from a journal of surgery, but it also concerns us as oncology nurses, and there are many pros and cons. Pros, as I mentioned previously, to have more skills, to have knowledge, to improve career, to develop from a logical and coherent perspective your thoughts, your ideas, your practice. But there are also, and we should acknowledge, some cons in publishing and in doing writing, which are today for example, the delays in publication or the publication charges. That's why it is important to be part of a larger group and to publish and to write together within a group. Once you have decided that you want to write, ideas should be developed from different sources of inspiration. Mainly, they appear from the clinical challenges you have in your daily practice, or you have some complex patients with cases very specific that you want to share with others, how you have assessed and intervened with this patient. And of course, information or research question comes from gaps in the literature, such as, well, how are the late effects of cancer survivors living with breast cancer 5 years after finishing treatment? So there are some gaps that we want to address in research and in publishing. And these strategies, the brainstorming strategies, as I mentioned, come from your practice, reflecting on your on your practice, daily practice, sorry. And also it is really important to discuss with colleagues, because researching and writing is a collaborative activity. So once you have decided, yes, I will go for researching and publishing, there are some interesting frameworks, such as the one I'm showing you, the SMART framework, that help you to identify or to develop a research question that should have these 5 specific characteristics. The question should be specific, so the research question should be clear, focused, and this is very, very easy saying in theory this, but in practice is harder. So you can ask questions yourself, like what exactly I am investigating, or who is the target population or the phenomenon I would like to research. Also, the research question should be measurable. Of course, if it is a quantitative research that I want to quantify the outcomes from my study, this is important, but also in qualitative research, things could be, well done or in a way measurable. So another aspect for a research question that help you to define a very clear research question is that it should be achievable. So the research question should be realistic and feasible given available resources, but also economic resources, time, and expertise. Because maybe I would like to write a very important paper with a lot of participants, and this is not feasible for the first part of the project. So I can do a smaller project and write about it. The question should be relevant in terms of that it is important to contribute to the field or try to address a problem or fill a knowledge gap. And you can ask questions such as, does this align with the current challenges or needs of in oncology nursing, or will the results benefit patients, nurses, or policies or healthcare systems? And finally, the T is time bound. So the research should be specific to a time frame for the study intervention. And that's why any research and also any papers have a start and has an end. So this is a very interesting framework that can help you if you are not used to develop questions. Well, I share with you some example of clear questions. This is not the only one, but just to have an idea. Like, for example, does a nurse-led education program improve medication adherence among oncology patients undergoing chemotherapy? Here you have the phenomenon, adherence to chemotherapy. You have the population, the nurse-led, and the patients, and the intervention, which is the educational program. And there are other or many other questions, such as, can telehealth follow-ups reduce hospital readmission for breast cancer patients within the 12 months post-surgery? So each of you have interest and have your own research questions. So I invite you to think very focused and clear and develop feasible questions. Well, once you have your research question, the first step that you should conduct is a literature review that will give you the tools first to identify gaps in knowledge in order to avoid redundancy, because if the research or the publication has already been written or published, there is no way to continue this. But we can modify some part of the text or some part of the research question and then write another paper. And also, conducting a literature review helps you to build a strong foundation for your whole research paper or your review paper. The literature review will give you interesting information from other authors, from other publications, to be strong in your argumentation and in your research. So then we have the literature review, and I think this is a very important message I would like to share with you, the importance of writing from the beginning, even though it is not in a formal way, or but it is writing is a habit, so it is important to stay motivated, and sometimes we're in front of the computer to write 2 sentences and it spends like 30 minutes or more. So set small achievable goals. It is important, and I would recommend creating a writing schedule, planning what I'm starting with, and so on. And I like this quote from the editor Roger Watson, a very popular editor. Now he's in the educational practice nursing journal, but a few years ago he came to Spain and gave a webinar, and I took this message: write 500 words each day in order to get used to writing, because it's not something that we do very commonly. You have to start working and do it. So my recommendation, right from the beginning. Then some practical writing tips for the writing is to be clear and concise. So I would recommend to use active voice and short sentences. And this is something, as an editor of a Spanish journal, this is something that I can see, especially from early career researchers, the long sentences with no goal. So, and use of very long sentences with passive voice. So, for example, as an example, I share with you, instead of writing this very long and very difficult sentence, the administration of chemotherapy was performed by the oncology nurses to ensure that all patients were receiving their treatments in an appropriate manner. Instead of that, just go direct and say oncology nurses administer chemotherapy to ensure appropriate patient treatment. And you are saying the same, but in a more concise and clear way. Another practical tips that I always share with my PhD and master nurses colleagues is start writing the methodology first, instead of the introduction, or first the methodology, then continue with the result, discussion, and conclusion. In any kind of type of articles, either it is a research paper or a review paper, and then start or continue or follow up with writing the introduction, the title, which should be the last part, the abstract, references, and the acknowledgements. So usually we see the article and we always start by the introduction, and then we get like a bit blocked. So this is my suggestion, and the author's suggestion to start with methodology. Another aspect that I think it's important is to be systematic in terms of clarity and focus, as I already mentioned, avoiding irrelevant information. Of course, in a first draft, you will write informally, so you will have a lot of information, and that's fine. But as far as I develop the writing and my article, I will be more focused and more clear in the sentences, and think that every section has a defined role. So all papers should have an introduction that sets the context of the phenomenon, a method section that describes the procedures, the results, showing the findings, and then the discussion and conclusions. And again, break the writing into manageable stages in terms of planning, drafting the first draft, the second draft, the third draft, the fourth draft. This is some very common aspect. Even though if we are experienced in writing, we do a lot of drafts. Another aspect that I think is important is to follow the logical flow of the sentences. And for that, I recommend to use connectors such as, the one I share with you, but there are a lot of more connectors to connect paragraphs or ideas within the introduction and the different part of the text. And finally, of course, avoid plagiarism. That this is an important point for any writing. So now in the few minutes I have, I would like to share with you very quickly, and then we can continue in the question sections if you have any further question that you want I get in that. So these are the principal part of a paper and how a paper should be structured. So they have title and abstract, and then Mark will focus more on that. An introduction, a method section, a results section, discussion, conclusion, the references, and then sometimes some journals allow you to add some supplementary files, and as I mentioned, it's optional. In terms of the title, some tips for the titles is that they should be very clear, concise and informative, capturing the most important aspect of the research. That's why it is the last point that we write in a research paper. And think that the titles are the most read part of a paper after before is the title and then is the abstract. So the title is very important, and also it's important because it serves as the primary hood for readers and for the database search engine. So it should be very clear and concise and informative. Then avoids vague or broad terms such as cancer research insights, and I can see that in my journal. So instead of using words that don't say anything, just go direct, and then the impact of nurse-led intervention on pain management in breast cancer patients. Instead of cancer research insight, to explore nurses-led interventions, avoid these vague terms. It is also important to be descriptive, and authors suggest having like from 10 to 15 words in the title. But again, I would recommend you to go to the author guidelines, and they will give you all the information about the extent of the title. In general, it's that between 10 and 50 words. Some titles, in addition to having the phenomenon and the population, will have the type of methodology used, for example, randomized controlled trial, or it is a systematic review or a qualitative study. And of course, avoid abbreviation and jargon in the title. It's also relevant. Once we have the title, I start with the title, even though it's the last point that we have to write. I would like to share with you some specific point about the introduction that should be organized in a logical sequence. So first, it should be start with a big picture of the general context and narrow, like like the figure that I'm showing you, narrow down the specific problem, introduce why it is important to conduct this research, what are the gaps, and then my aim is blah blah blah. So being more in detail about what I have mentioned and share with you, this would be like the way of writing an introduction. The first point is capture the reader attention and create interest in the topic. That's why usually introduction starts with statistics or facts that highlight the importance of the topic. For example, now I show you here globally over 9 million new cancer cases were diagnosed in 2010, with nurses playing a pivotal key role in managing patient symptoms. So I'm saying this is important, because there are so many diagnoses and nurses have a key point or key role to managing these symptoms. After that, provide context, give background information to help readers understand why it is important, describing the broader problem, highlighting what are the gaps, and discuss relevant trends in the field. That's why in the introduction we used references as well as in the discussion part. Once we have the context, clearly state the problem, be specific and define what are the specific problem that will give you the point to highlight why you are conducting your research and emphasize the practical and scientific implication of your work, why it is important. And finally, write the research aim of in your article. Sometimes the section of aim is a separate section from the introduction, according to different journals, and sometimes it is part of the introduction. So again, follow the author guidelines of each journal. Then we have the introduction, we go to the method section, and this will be writing according to the type of methodology used. Either it is a quantitative study, a qualitative, or a review study, but mainly they have the very similar subsection. As you can see, we will write about the study design, the participant characteristics, the inclusion and exclusion criteria, type of recruitment, the sample size, the variables, if it is a quantitative research, or in data collection in qualitative research, the type of method that we will use. In quantitative, the tools, the instruments, the procedures that will be conducted, and then the analysis, either it is statistic or more qualitative analysis, and finally, ethical consideration. In qualitative studies, we will also introduce the rigor section, like trust witnesses and how the study had been conducted in a rigorous way. Well, after this section of methods, we will write the results of our research paper. And here it is important to report the main results, because then we have so many information from the project that it is difficult really to reduce to the main and the main results. So pay attention to write the 5 main results of your research, organizing this information by themes or variables in a logical order. For example, the most important results followed by sub aims, for example. It is recommended to use tables and figures to combine and to create an homeostasis between writing and data and visual data. And then also highlight significant findings, as I already mentioned. And of course, address negative results. If you have unexpected or non-significant findings from the results, this is a key results from the research. So do not avoid to explain the unexpected or negative findings from the result. This is very important. And again, I would like to show you the importance of in the results section, avoid interpreting or discussing results. This is something that I can see very often in the articles. So in the results, you have to write the data you have found. And in discussion, you will interpret what your data are meaning. And this is some intellectual aspect that we have to pay attention to that, because it's a common error especially for early career. Well, we had the results and then we had to write the discussion. So summarize the key findings, interpret the results as we mentioned, and here you have to compare with the literature. That's why you will use references in these sections, addressing the unexpected results, and very importantly, in this section, we have to write the strength and the limitation of our work. Any paper, any research paper, any review paper have limitation and also strength. And for sure, discuss the implication from a practical, theoretical impact, but also political impact, research impact, whatever the implication of your results. And finally, write the conclusion section, which is very short, very concise, summarizing the most important results. Sometimes we start saying how we have responded and addressed our aim, starting the conclusion in that way, highlighting the implication again of your findings, and avoid introducing new data or ideas in this section. And actually, this section does not have references. Also, provide a take-home message in the conclusion if possible. Be clear about your main results and give the readers a take-home message and suggest further discussions. I would recommend to also follow the guidelines for reporting quality and transparency research. You may know this Equator network according to the different methodology. If you are conducting a qualitative research, then use correct, or if you are doing a review, the Prisma Equator network guideline. And finally, the references, which is nothing related to intellectual aspect, but it is a very important section because it shows you that whether the writer has paid attention to the journal's guidelines and to the writing. So I recommend to follow the journal style guidelines, if either it is APA, Vancouver, any kind of type of references. If possible, because then you will save time and effort, use some reference manager tools such as EndNote, Zotero, Mendeley. There are many, very easy to use, and be consistent, as I mentioned. Use the same type of references across the section, and avoid common mistakes such as ensuring that all in citation are in the reference sections. So if you have cited in the text some authors, then they should be in the reference section. And double check the spelling and formatting errors, which is, again, it is nothing intellectual, but very important because it shows the quality of the research. You can use AI for editing, for proofreading, for translation, and for grammatical accuracy and style consistency. If you want, we can talk further with that. And finally, you have already your paper, you have finished all the section, and then you have to send it to a journal. So I would recommend to choose a relevant journal. We have many for cancer or oncology nurses from the specific field, but also from other fields, and consider the type of audience, the focus of the journal, the impact factor, the reputation, and also the author guidelines, the words. For example, if I have a very long paper, then maybe one journal will allow you to have 7,000 words compared to another one which only allows 5,000. So pay attention to that, and then choose your journals. Well, some flow and common problems I have already mentioned to you in the presentation, and because I can see the time is on. So just to finish with the take-home message, remember that you can, and so think about getting started and from the beginning and continue writing. Important to manage time, and each section has its own role, and structure it in a logical way, ensure originality, and be concise and clear, and then understand the journal requirement. And once you have already sent the paper, wait for the reviewer feedback and respond as soon as possible when you receive your feedback from your paper. So these are some references that can help you, and thank you so much for your attention. I would be very happy to have a dialogue or discussion with you now. Thank you.
Thank you, Cristina, for your presentation. We have a few minutes, and I have for you some questions from the audience. One, they're asking you, which is the best journal in oncology nursing in Europe?
Wow.
Tough questions.
A tough question. If the editors are there, they will be not happy with me. But well, one of the best journals in terms of impact factor is first the European Journal of Oncology Nursing, second the Cancer Nursing Journal, and also Seminars in Oncology. These are in terms of impact factors, but any of the one that I show you and are relevant articles, I would recommend you and be very pay attention not to send to predatory journals, which are those journals that, you know, don't have a clear editorial team. They only want money and it's not quality. So this is an important message. Avoid predatory journals and go to, for example, the journal citation report website that will show you the most relevant international relevant oncology nursing journals.
Thank you. I have another one. Do you advise when doing a literature review having a plan to implement findings?
Just to check if I well understood the question, they are asking if it's important to do a review previous to conduct the research and apply the findings. This is the question?
Yes.
Okay, thank you for the question. Well, and a very interesting question. Maybe this is a qualitative researcher because, you know, usually any research should be proceed and should be before conducting. We have to do a literature review to know what are the most important findings, what are the gaps, as I mentioned, or have the most current evidence from the phenomenon we are investigating. But for example, in qualitative research, and specifically in grounded theory, it is not suggested to do a very extensive literature review at the beginning, because the aim is to develop substantive theory. So you do a very superficial review just to know if the research has been conducted and to avoid being like biased for the results. But for example, for quantitative research, you will conduct a very extensive research at the beginning of your topic and also in the review. If you conduct a review, you should do a review. Yes.
Thank you. I have another question for you. What role do nurse mentors or collaborative teams play in supporting early career oncology nurses to develop their writing skills and contribute to the field of oncology research?
Well, thank you for the questions. Because as I mentioned at the beginning, you are early career nurses in oncology, but I'm sure that you have different background and experiences. But anyway, in any stage, we are doing a collaborative work. So I think it's very important to share with mentors or with colleagues your ideas. Even, I haven't said that during the presentation, but when you finish your paper, you have to give your colleague to read and criticize the paper, because it will improve before sending to a journal. And also being part of a group have many benefits, such as they can organize webinars, you know, how to write. We can share, in my research group, we share with the novel researcher, the PhD students or master students, the different writing. And so the most novel researchers share, and then in groups, we give some feedback and we learn all together. So sharing and being part of the group, I think, is essential for growing as a researcher and as a writer. So my recommendation is being or try to ask for collaboration with colleagues and even with research groups that you may know. There are some groups in your university, in your clinical practice. Just knock and say, hello, I'm here, I'm interested in doing research and I would like to learn more, and they will be more than welcome.
Okay, thank you, Cristina. Thank you for this presentation and for your time. I want to say something to the participants that they are asking to have your presentation, that they can be that this webinar is recorded, so is always available to see. And hand over to my co-chair, Nuria, to present the second part of the webinar.
Well, good afternoon. Now, I would like to introduce the next speaker. Well, the next speaker is Dr. Mark Dornan from Northern Ireland. Dr. Mark Dornan is an assistant professor and an early career research at Queen's University in Belfast. He has a professional background in adult nursing. Alongside his dedication to teaching, Dr. Dornan's research focuses on the areas of cancer survivorship and supporting patients and families with psychosocial challenges. Mark has worked in the digital technology industry, and he has a continued interest in nurse informatics and ethical practices of IA in healthcare. And now, Dr. Dornan will start his presentation. From abstract to impact, creating scientific conference posters and presentations.
Perfect. Thank you so much, Nuria, for the introduction. Can you see the screen okay?
Yes, we can see it perfectly.
Perfect. Thank you so much. And thank you so much, Professor Garcia Vivar, for your presentation. I was taking lots of notes, particularly in around writing as a skill. I think it is something that we have to work on all of the time, for sure. So I was taking lots of tips. So thank you so much for the introduction. My name is Mark. I'm from Belfast in Northern Ireland. So I'm going to apologise now for my accent. This is how we speak English in the north of Ireland. So it's a little different. So please, if you want to ask any questions for clarification, I'm very happy to answer. The most important thing about my introduction is that I have two large dogs who are very close by me. So if you hear some barking or some sounds, it's these two. And I always like to put this up at the start of my presentation so people are aware of who is making the absolute fuss around me. But like Nuria said, I'm a nurse and I'm part of the Young Cancer Nurse group here at EONS, and it's a fantastic, lively, organised group where we do lots of different projects or different meetings. And if you're not part of that, it's something that you could consider being part of and speak to Erati or Nuria or Francesca about that. And I've worked in digital technology and I incorporate that partially into my research now. And my work for my PhD was in with patients with head and neck cancer, an often underlooked type of cancer, but very important because of the profound effects that they have for the rest of their life, and also the impact that it has on their family members too. But this evening we're here to look at abstracts, posters and presentations, three key components whenever you get to go to conferences or scientific meetings. And as part of our role as nurses, we get to sometimes go to some of these academic conferences or the symposiums or meetings and things like that. And there can be a lot of things going on that we're maybe not super familiar with, that we don't see so often. So it's really nice to get that experience, to be able to talk to people about their work, talk to people about work that we don't necessarily see, because we maybe sometimes work in one type of oncology or we work in hematology, but we're not experiencing some of the things that other people are really talking about or working on, which is wonderful. So I'm going to start off a little bit. It's different from what Christina was talking about in abstracts with academic papers. So you've done the research at this point, you've done your work, and now you're going to a conference to share that with people. So the first aspect of that is proposing an academic abstract for this conference. It's really a concise summary of the body of work that you have done. It provides some of those key pieces of information that Christina was talking about as well. Yeah, purpose, the method, your results and your conclusion, but it's usually very, very short. These abstracts are quite important because you're submitting that for the hope that you can have a poster or that you can have a presentation at the conference. So it needs to, in a succinct way, communicate your idea, why your idea is good and worthy of being shared at this conference. Sharing things like abstracts can be quite hard because you need to minimize your amount of words. You might have lots of ideas in which you want to share and not a lot of space in which to do that. It's good to share these conferences or to share these abstracts with others because it's an opportunity to talk to peers. We get to receive feedback. We get to make connections with other people who are working in our field. Like Christina was sharing as well too, it's very important to adhere to the conference guidelines. If you're targeting a journal or you're targeting a specific conference, they will have a set of word counts, they will have a set of style they want to see, they will have a set of maybe ideas that they want in there too. So making sure as well, when you're going to a conference, it's a conference that's relevant for your paper. So something like EONS, where it's all about cancer and it's all about cancer nursing, really relevant for your research. If you're going to something a little bit more about nursing in general, you have to push maybe your idea to fit in with the theme of the conference, and that needs to be highlighted within your conference abstract. Key parts of a conference abstract here are then highlighted on the right-hand side, but what you would look for is that title, that succinct summary that's clear and concise with your title. A little bit of a background as well to include your justification and aim. Your methods, what's that key methodology? Is it a systematic review? Is it a literature review? Have you gone and done some empirical data collection with qualitative research or quantitative research? So a couple of sentences to highlight what you have done or what methods that then you have used to collect that. The key point of this then too is what is new? What have you discovered within that? Why should the people want to hear or see your research in a conference proceeding, in an abstract, in a poster? And then finally, your conclusion, what this means as well. So if you're proposing something within cancer nursing, can that be how this impacts the clinical cancer nursing workforce? Is there something around education, or is it having an impact for patients, and including that in your conclusion? And you can see on the right-hand side that actually the most of your work is going into that results section. So what is key? We'll talk a little bit about this more, but whenever we were reviewing some papers previously, it can be a lot of work in that upfront section about your background, but not a lot of that is new. So when we come, for example, when we talk about prostate cancer, we know that prostate cancer is a problem. We know the sort of demographic of people that it impacts. We know that there is a certain number and we're aware of what type of treatments. So we don't need to concentrate a lot of that in our background because the audience will generally know that. But what we want to know and understand is what you're bringing that we are going to learn. So those are the key parts of an abstract. Now, that being said, we again want to adhere to guidelines. So I've highlighted a couple of examples here. So if your abstract gets accepted to the conference, it usually gets published in maybe an associated journal. It could be published online. It can be something to take away. This was the Canadian Association of Nursing Oncology. So a relevant and relative of the EONS. But you can see from these examples, actually, even with that standardization approach of doing your background or your objectives or your aim, that even within these 2 pages side by side in the conference proceedings, they're all different. These look different. So how you might present your abstract can be a little bit flexible at times, ensuring that you are looking at some of the most important things that the journal or a conference will expect to see. How to get started. Again, like Christina as well, to writing, getting something down, get into that routine is how you get started. What is it you want to share? That's the important part. What is it you want to tell people about your colleagues from around the world who maybe work or do not work in your area? What is it you want to share with them? And that can be both reflected in your title and also your results. What is it you're bringing your information from to? And that's quite important. So are you bringing this from your research? Is it a clinical audit? Is it literature? Or are you doing it from a master's study? Because each one of those will have different pieces of information that you'll want to glean from whatever you're looking at to share. Is it new? Is it novel? Is it something exciting? Who is involved and their permissions? So you will all work as part of teams, or you work with part of clinical partners or academic partners. Make sure that you get them involved too, because you want to make sure that you have that feedback from them as well, that critical friend where they're giving some advice, but also their permission to put their name on it as well too. Or if you've worked in collaboration with someone, that you're giving them credit for the work that they have put in to what you're going to subsequently be sharing. And finally, can you attend the event? Quite often, whenever you're submitting an abstract to an event or a conference, you want to make sure you'll be able to attend so that the event organizers know that if they accept you, you're going to be able to come and present your poster. And you want to make sure that someone in the team that is going to be able to make it as well. Some key tips from that then too is adhere to that guideline. Similarly, when writing that exactly, it's that clear and concise language. It's a very, very small word count, so you have to get rid of lots of words and be straight to the point. Follow that structured format, whatever that might look like. Highlight the significance of your work. Providing that little bit of context can be very important, particularly if you're bringing a view from your own country or from your own setting. Providing that context of where the research is conducted can be very important. And if it was conducted in a different language or what type of groups of patients you're working with. And certainly I've had wonderful conversations about how we might do something in the UK and Ireland and how that might be different if you're doing something in Spain or Italy, for example. So I think that that can be really an interesting point to make in our approaches to it. Those methods and your key findings. It's really lovely to see the implications for nursing within that too. And very important to proofread carefully. It can be whenever you're reviewing some of these or looking at some of them, some of the things that give it away initially is very unclear language or there's nothing so new with it. But particularly if you're communicating in a second language or a third language at times as well, you want to make sure you're seeking some feedback from other people about how you might share that specifically. And just then to highlight really for some people after your submission, what goes through to a scientific committee and they screen through it and they peer review it, and then they might select for some people to come and present at that, and they will then notify the authors often in 6-8 weeks, maybe even a bit longer. Do not be disheartened if your abstract doesn't get selected for a conference. That is all part and parcel of the game at times with conferences. Do not be disheartened. We have all been there where we have submitted something and it hasn't been selected. So persevere. It just might be that you need to look at it in a different way or submit it to a different conference, and that's fine. And all of these things will really help you to that publication, like Christina was talking about, or that presentation at conferences. Just a quick note on your poster presentations as well too. So these are similar. So these are the visual display of your abstract. This allows us a very attractive way to look very quickly at how you have done something, what it might look like. A large audience can see that, but people walking past all of the time, so they can see this over days or hours to have a look at what your research is. You might not be there, but you can include information about how they can reach you. And it gives you that opportunity again to speak to others, to grow your network and develop some future research ideas. The most important thing for a poster is that people are walking past, you need to grab their attention in 1 or 2 sentences. What is that key message that you want to display in big bold letters at the top of your poster so that people will stop and read, and everything else should center around that. They want to see what is new, what you have, and then what you have done, and then also its implications to practice. So if your abstract gets accepted and it's 150 or 200 words, you've got a little bit more space to play with that with the poster, but that key message should really stand out. Some practical tips just for creating your poster: have a look at other people's. What is expected in the field? Is it lots of pictures? Is it colors? Follow those conference guidelines too. Sometimes they can be straight up and down, sometimes they can be landscape, sometimes they can have a word count, or you might need to put specific emails into it. Keep on time to make sure that everybody's got them. The best way to create a presentation is to use Microsoft PowerPoint, and that really helps to create it there rather than using some other software. At times it helps you be able to visually see it. It does take time to create one, and it can be multiple drafts at times where you have to change that and get feedback. So leave yourself enough time to do that, and put your poster under the most relevant category that you think is going to get the best exposure and the best conversations. Again, these are just some ideas that you would need to put in: that title, who's involved, how they can reach you, some email contacts or a website or some social media. The same standard format of that: backgrounds, methods, findings, discussion. You might have some images or figures or QR codes about other research, and think about your colors and your font that's going to get people to be attracted to it. And finally, then on the day of presentation, find your area. You might see something to stick it up. I've been to conferences many times with a poster and there's nothing to stick it up and I have to go and find something to put it up. There might be a poster presentation time where your poster, you get allocated to go and stand beside it and people will walk past. So don't be afraid to have a few discussion points to stop and talk to people about your poster. Also, on the other side, not everyone's going to stop. So don't be disappointed if you don't get lots of conversations, but sometimes some of the really good conversations can happen whenever people stop by to speak. This is an example of a poster that I did recently as well. You can see that at the very top is this big, bold writing so that people can instantly understand what it's about, and then a subtitle to give a little bit further, and then some pictures and diagrams in there as well. This one right in the center, I put the methods instead of a dialogue as a picture so that people could see very quickly how we moved across the methods. And then again to some really short pieces of work. But in the bottom right, you can see how I'm signposting people to other pieces of work as well and how they can contact us. And then this is just at times what it looks like. You get your poster and they can all look differently according to the conference, and then you get to stand beside them whilst people will walk past and have some of those nice discussions. And I'm wearing the same shirt in both posters at 2 different times. So you can always do that. And finally, as well, just some tips on your conference presentations. So some of you will maybe not give a poster, you might give an oral presentation where you might get the opportunity to speak about your research either a little bit longer. The first thing I would say is know your audience. Who is at the conference? We will speak to lots of different people. If you go to a cancer nursing conference, you want to speak to people who instantly know about cancer nursing. You could go to an oncology conference, which has multidisciplinary professionals, so you might not be super familiar with nursing. Or you might go to a nursing conference where there's lots of different people there who are outside oncology, and how you might need to tailor some of your information according to the type of audience that you have. One of the most important things is about knowing your time limit. I was at a conference recently and everybody had 5 minutes to present. And I would say that only 50% of the people were able to present within that amount of time. And what unfortunately happens is that people spend so much time at the start is that they then don't get to the important parts of their research at the end, the really good stuff that they have done. And the moderator or the chair has to stop them so that they move on. So know your time limit. And practice, practice, practice. Many times that I've practiced speaking about this in front of my mirror or at home, just to be able to make sure that I'm within my time frame. But particularly if you're doing it in another language as well, definitely that opportunity to practice. I recently had to do a presentation in French, which was the most nerve-wracking thing I've ever done. And it gave me a whole new view on presenting in another language. And it's not, even if you have an amazing language skills, at times it's always good to practice that with this scientific language too. So well done to people who do it outside of their first language and get that feedback from others. Make sure you got that key message and takeaway point. Be confident and enjoy yourself. This is your opportunity to share your work. So you're presenting something that people don't necessarily know about. And you might have to then manage and handle some questions. So managing and handling questions, people do like to ask. It's not about being totally defensive or that you've got something wrong, but people want to know a little bit more. So thanking people for their question and then addressing it in a positive way that you have understood for their question as well. And that takes a little bit of time and a bit of experience. And finally, if you're doing a presentation online, always manage those technical challenges as well in advance. Try and sharing your screen on Zoom or Teams can be a skill in and of itself. So making sure that you have a little bit of support or a practice with that too. Thank you so much. That was a brief whistle-stop tour through 3 very important components. And I hope that then you'll be able to pick out some of the tips on how to prepare for an abstract, a poster, or speaking at a conference. Thank you very much. And back to Nuria.
Well, thank you, Mark, for your presentation and for the tips you gave us. It was a really interesting presentation. And now, well, we would jump into questions. Does anyone have any question to? Okay. Well, they are asking you, how can artificial intelligence tools like IA-based design or content suggestions assist oncology nurses in creating more engaging and effective scientific posters and presentations?
A good question. It's a great question, and I saw a question come about that for Christina's too. Yeah, absolutely. So we're still trying to understand in academic research and literature reviews how we can best use artificial intelligence. Absolutely. However, so we want to avoid plagiarism. We want to avoid generative AI taking credit for things that we have done so that we're speaking in our own language. However, it can be really helpful for some of these ideas. So for example, there are lots of artificial intelligence and presentation platforms that help with how we display posters, which is actually really, really helpful. They can help us with design because we are nurses or we are researchers. We're not necessarily graphic designers. So things like that can help. They can also really help with language, particularly about how we could phrase something in an academic sense, or we can help to cut out some words just to make it fit. I think that's quite important. And those are some of the ways that would definitely help with artificial intelligence poster design.
Well, I have another question for you. How can oncology nurses strike a balance between visual appeal and scientific rigor when designing conference posters?
Oh, good question as well too. So absolutely. So I think that's one of the things that I found most difficult about if you've got scientific, rigorous academic papers and turning it into something visual. I don't think that we need to lose our scientific rigor. I think that at times we just have to be very mindful of the amount of words that we get for that. So we need to communicate in a very succinct manner to be able to still display our rigor within it, but just in a smaller word count. And unfortunately, that at times means that we have to lose some of our background or some of our other things that we would like to talk about. But certainly too, I think there are lots of pieces of information out there about how we learn, what attracts us. We know that lots of people don't read a paper, but they will maybe get some information from something like YouTube or from actually seeing visual representation. So I think posters can help with that as well. And certainly it helps whenever we can, people use photographs of the scenarios or the research or the situations, particularly diagrams with patients or patient feedback as well, which can be displayed really nicely. So I don't think we need to lose our rigor. It's just about how we can present it appropriately.
We have another question. They're asking if, well, you can present the same research or poster at multiple conferences, or if they just accept like new one research or novel research.
Yeah, great question. So at times, depends on the conference. So some conferences will make you specifically note that it is novel. Some will not. At times, what people will do is they might present a different angle on their research. So again, if you do research with patients, you might present the patient angle of it, but the same question you've given to family members and you might present it on that. Or some people will talk about the literature or one particular finding. So it might be that some people reuse the same process or research, but present something that's slightly different. For example, if you're going to a nursing conference, you might present something slightly different if you're going to an oncology conference. So it might be the novel findings there that are slightly different, but that's a good question too.
Okay, well, thank you, Mark, for answering all the questions and for the tips you gave us. And well, with this, we're going to end today's webinar if there are no more questions. So thank you all for attending, especially thank you both, Dr. Garcia Vivar and Dr. Dornan, for your insightful presentations. And well, thanks to you, from now on, it will be easier for us to write a scientific paper and also to share our results in conferences. As someone who's starting or who wants to start her research career, I really thought these were interesting presentations and very helpful also. And well, it was a pleasure having you both today here. So thank you again. And lastly, I would like to remind that next Monday, the 2nd of December, we will host the last webinar of this Nightingale Challenge series. It will be on promoting cancer nurses' well-being and fostering a supportive work environment. Well, you can see the QR here if you want to register now. And it will take place at 6 p.m. Central Time, just as today.